Gut Punched, Alzheimer's, and Caregivers. Navigating the insidious illness of Alzheimer's is something nobody asks for. The disease sneaks up on you and your loved one, and it feels like you've been sucker punched in the gut. Then you ask, where do we turn for help? Who do we call? What do we do? These questions and more are what we hope to answer and give you some direction and hope. Now let's join our host, Jeff Edwards.
Greetings and welcome. Well, here we are again. Gut Punched, Alzheimer's and Caregivers, episode 32, or No Tropical Hurricanes This Week. The countdown continues. Are you doing well? I hope so. It was a crazy week, no doubt. The only thing that's constant is change, good or bad. And all I have in my pocket is change. Wait, where's that rim shot? Well, we have a lot to talk about today, and we'll cover an article about too many meds can harm Alzheimer's patients. We'll have a fascinating interview with Dr. Adam Perry from HealthSpan Partners, and he'll explain in depth something we've been touching on the last couple of episodes. It's a new government program from Medicare called The Guide. If you haven't heard about it yet, give this a listen, especially if you are a caregiver and you need some help. This might be for you. The Guide, Guiding an Improved Dementia Experience Model. Now, this program offers enhanced services for dementia care and support for caregivers, a relative or unpaid non-relative who helps with activities of daily living, improve the quality of life for people living with dementia, enhance support for caregivers of people living with dementia, and help people living with dementia stay in their home and communities longer. That's what Guide is. And we'll update you on some of the Walk for Alzheimer's locations for the next few weeks. Okay, what are the 3 rules or suggestions we follow here at Gut Punch, Alzheimer's and Caregivers? Number 1, you have to take care of yourself, because if something happens to you, who's going to take care of your loved one? Number 2, you can't do it alone. You need help. Find good caregiver groups or networks with friends and relatives. And number 3, make a list of people, friends, relatives, coworkers who have offered to help you in time of need, and then make a list of things you need done, but you can't do yourself because caregiving duties are overwhelming. Use the lists, start at the top, and keep going till you get what you need done. You'll find it very helpful. All right, it's time. Let's begin. Here's an article from Newsmax called Too Many Meds Can Harm Alzheimer's Patients. Alzheimer's disease patients prescribed fistfuls of daily drugs are at a greater risk of harm, a new study warns. Patients with Alzheimer's prescribed 5 or more daily medications suffer from more symptoms, falls, and hospitalizations, and they are at a greater risk of death. They also experience more functional decline, required more assistance with activities of daily living like eating, bathing, and dressing, and were more likely to need an assistive device like a cane or a walker, said lead researcher Martha Coates, a postdoctoral research fellow with Drexel University's College of Nursing in Philadelphia. Now, taking 5 or more drugs daily, called polypharmacy, is a significant concern for folks as they age, researchers noted. Now, the cutoff point of 5 or more medications daily has been associated with adverse health outcomes in previous research, and as the number of medications increase, the risk of adverse drug events and harm increases. Estimates show that more than 30% of seniors are affected by polypharmacy. However, there is little research on how polypharmacy affects people with Alzheimer's or related dementias, researchers said. For this study, researchers drew data from the National Health and Aging Trend Study, a research project from Johns Hopkins University focusing on Medicare beneficiaries. They analyzed a sample of more than 2,000 people from 2016 to 2019 to track changes in symptoms, diseases, and physical function. We found that older adults with Alzheimer's disease and related dementias and polypharmacy experience more unpleasant symptoms, increased odds of falling, being hospitalized, and mortality compared to those without Alzheimer's disease and related dementias and polypharmacy. The new study was published recently in the journal Biological Research for Nursing. There are tools available to help with healthcare providers manage heavy medication regimes for older adults, but these tools aren't specifically designed to fit the needs of people with Alzheimer's or dementia, Coate noted. More research is needed to develop strategies to prevent or manage polypharmacy in seniors afflicted with Alzheimer's. The older population in the U.S. is growing, with an estimated 80 million individuals over the age of 65 by 2040. This means that the number of older adults diagnosed with Alzheimer's disease and related dementias will also increase, and currently there is no cure. Avoiding adverse outcomes related to polypharmacy can improve quality of life and prevent excess disability for older adults with Alzheimer's disease and related dementias. Pretty interesting.
We'll be right back to Gut Punched, Alzheimer's and Caregivers.
Repeat after me. Apple, table, penny.
Apple, red.
When you tell people he has Alzheimer's, but he's in a clinical study, it's
not so hopeless.
Yeah.
Maybe. You know, it's like, I hope we can just hang in there and maybe they'll find something, you know.
Ask me again.
What season is it?
It's when all the leaves down and
I know it's there, but I can't get it.
Yeah.
And it just kills me.
I remember watching Dad interact with the kids and thinking, geez, in 5, 6 years, will he even know who they are? 1 in 10 Americans over 65 has Alzheimer's disease. Learn more today at brightfocus.org.
This is Gut Punched, Alzheimer's and Caregivers.
Get ready for a very interesting interview with Dr. Adam Perry. We've been talking about this for the last few weeks, and the program is called The Guide. It's a governmental program issued by Medicare and Medicaid, and it's going to have legs. It's really just beginning, and it's got a lot of great information and a lot of great resources for caregivers and people that have Alzheimer's or dementia. So check this out. You're going to like this. Greetings, Dr. Perry. How are you today? Thank you for your time. Can you tell us a little bit about who you are and where you came from?
Sure. Thanks, Jeff. I'm Adam Perry. I'm a geriatrician. My practice is called HealthSpan Partners of Southwest Florida, and I'm here in the Naples area. And like so many people from in this area, I've been here about 5 years or so. And before that, I was in Pennsylvania, most of the time in Scranton and Philadelphia and Pittsburgh, and happy to be here, particularly this time of year.
How did you get involved with The Guide?
So The Guide is brand new from the Centers for Medicare and Medicaid Innovation. I've been working as a geriatrician in the space of high needs older adults for quite some time. And my focus has been on older adults with special vulnerabilities. So cognitive impairment, dementia, functional impairment, homebound, for people who have both. And I've worked with this population in multiple settings. I did a lot of time in the emergency department, actually, in a model called the Geriatric Emergency Department. And then during the pandemic, the combination of our unique needs at that time and technology drove other models. And I was lucky to get involved with models like home-based emergency care, hospital at home, telemedicine through paramedics. And being involved in these models, I became familiar with the Centers for Medicare and Medicaid Innovation and was able to apply for this program. It's often run by geriatricians, although different types of providers are involved, and get accepted. Just started in July, so just a couple months ago.
Yeah, interesting. Now, this came from the Biden administration, April 2023 Executive Order 14095 on increasing access to high-quality care and supporting caregivers. And that was the beginning for the program, correct?
It is. It was a unique program in that it happened exceedingly quickly. You mentioned, in April of last year or so, they released what they call a request for applications in the summer, but really in November, the official point. And applications are due in a couple of months, so in January or so, and then people were accepted in April. So this has been a unique Medicare program, and then it's been really fast-tracked because there is a rapidly growing appreciation of the challenges associated with dementia, the growth in the population of people with dementia, and very importantly, the key critical issues facing caregivers for people with dementia. So the administration really focused on it, fast-tracked it. And a lot of the policy talk currently is to continue this program and to continue other supports for people with dementia and caregivers.
Sure, every little bit helps, and a lot of people don't understand when they become a caregiver, all of a sudden they go, oh, okay, what do I do?
Yeah.
This is something that they can be directed to for help and information. And I think I mentioned to you, I don't know if when we talked about it or an email, the last couple episodes of Gut Punch, I would bring a little bit more information into it. And I actually had questions from people from the men's group that I go to. They're hearing about it. Some people don't have to get involved with it, and some people go, I really need something like that. This is a good thing to talk about. Can you give us an explanation of the services that are provided with a little bit more detail?
Sure. Yeah, I think there's sort of two aspects of this. The first is just the unique background of this program and how it works with other elements of medical and community-based care. And then the other is the actual model. This is a program from the Centers for Medicare, but it's within the Centers for Medicare in a program called the Innovation Unit, or CMMI. And the important part there is that that's a separate fund almost. And they use this program, or this unit, to test new programs and benefits to see if they'll be helpful. And so the guide program, although it's a Medicare benefit, is completely additional to any other care that a beneficiary receives. So everyone, people participate in the program, they keep their doctor, they keep all their hospitalization and all of the other services. This is truly additional, and it's a way for Medicare to see if this type of model can improve quality of life and sort of help to reduce hospitalizations and long-term institutionalization. So that's the big picture. I can describe elements of the model, or any questions on that?
Yeah, that would be wonderful. I know what the model guide or overview is based on what I've researched, and because the guide model focuses on comprehensive coordinated dementia care and aims to improve quality of life for people with dementia, reduce strain on their unpaid caregivers, and enable people with dementia to remain in their home and communities. But how does that apply in practical ways to people involved, caregivers and those with the brain illness? Is it really a hands-on once they get involved? And you can tell me about that too, but do they have somebody help them navigate all the steps? How does that work?
Sure. Yeah, this is based on the thought that people with dementia and caregivers shouldn't face this alone for lots of reasons. And so they've developed sort of a model that includes 4 pillars. And the first is just as you said there, care navigation. This program is committed to providing every person with dementia and every caregiver who participates with an expert care navigator to help them move through and access resources. So these resources might be community-based services like nutrition or meals, transportation, day programs, the legal supports. It might be a medical need, and particularly transitions of care as someone moves maybe from an outpatient setting to inpatient to skilled rehab. And the care navigator is a dedicated person who knows the system very well, has been working in senior services, and has special training as set up by Medicare to work with people with dementia and their caregivers. That's a huge deal to help people to really, as you mentioned, no one is trained in this. The care navigator is trained in this. They've got a lot of experience and they can help. The second pillar, if you would, is caregiver support and education training. And the care navigator and other resources are utilized to help the caregiver understand the disease process, potentially any progression, and to access resources that they may need, including a 24/7 call line. We understand that Medicare understands that questions will come up, and it's best to have somebody to talk to quickly. Yep, for sure. Then within caregiver support, an important part of that's been getting some attention is respite. And for people with dementia who participate with a caregiver, and that's usually a family caregiver, it's not a paid caregiver, they're eligible for respite. And this means that Medicare will pay $2,500 a year to give the caregiver some time to take care of themselves And this could be, paying for a certain number of hours of in-home care, day programs, and then even facility-based 24/7 care should the caregiver need to, say, have a procedure on their own or leave town. And Medicare realizes that it's exceedingly important to support caregivers, to educate caregivers, and then give them respite. And I can talk a little bit more about the respite program if you're interested.
Yeah. The
specifics of that, I think, are important, and it's $2,500 to pay for in-home care or a day program if you go. And they'll, someone who participates could use that amount for the year to supplement sort of what they're already doing, or to begin a new program or a new service to give the caregiver some time. And that amount sort of rolls over every year. So it's July 1st to June 30th. And so if someone joins or really if someone activates their benefits, say in April, they'd have 3 months to utilize that respite benefit until the next year. Sort of a new approach from Medicare, because in the past, in other programs, they don't pay for any type of service for home care or personal care.
Sure.
And then the last pillar there of this model is a medical component, and Medicare is using the guide model to disseminate some evidence-based information to the rest of the care team, primary care, specialists, inpatient services, whatever it may be, with regard to very specific fields, and then that would be use of high-risk medications in older adults with dementia, and the management of co-occurring conditions. So if someone has dementia, particularly moderate or severe, what does the evidence tell us about how we may approach diabetes, or how we may approach blood pressure, or how we may approach screenings in people who have significant cognitive impairment? Those are the pillars of the model. It's a demonstration pilot, as I mentioned, from the innovation unit. And so I think the take home there is that the participants in the model, and there's only 95 across the country right now, we each design the pilot differently. We have to provide these services, but the innovation unit gives us the freedom and flexibility to tailor it to our community. And that's one of the exciting things here in Southwest Florida and in Florida more generally, is how do you build this model to support as many people as possible?
That's interesting. I didn't realize that. But it makes sense to say, okay, you're here in Southwest Florida. The people, a lot of them have come from other places, but Florida is a little bit different than, say, from New York or from California or Detroit or wherever they're coming from. So it makes sense to tailor it to a particular community. I think that's a great idea, something I didn't know about.
Yeah, absolutely. Each community has its own network of senior services, supports, organizations, medical infrastructure, and Medicare is very dedicated to making sure that every Medicare beneficiary who has traditional Medicare, so not Medicare Advantage, and has dementia is entitled to this new benefit. And part of my role here is to really introduce the benefit widely and get as many families and people this care that now they're entitled to.
So I was thinking initially when you talk about caregivers, well, they're from the federal government. But do you, as somebody who's involved with this, do you then go out and find the caregivers, the people that would qualify to help? Or does the government say, okay, now you're going to have to use this person, and this person?
Yeah, there's a few parts to that question. So just so I can clarify, when I say caregiver with regard to participating in the model, I mean a family caregiver, an unpaid person who helps the person with dementia, with self-care activities. It could be paying the bills. It could be medication management. It could be, personal things, toilet and shower and that kind of thing. So that's a caregiver who may participate in a program with a person with dementia. Although people with dementia can participate without a family caregiver. And then there's the care navigator.
That's the name.
And the care, that's the expert person who really talks on the phone. And this is 95% a telephone model. Medicare knows that you have to provide the ability to speak with people on the phone. We can't have a clinic-based model for a dementia population. Just too high a hurdle. And so the care navigator, they're really been very expansive. Certainly people who are nurses or social workers can be trained to be care navigators, but Medicare also wants to maximize the workforce, the dementia care workforce. And they're doing that partially through this model by issuing sort of a curriculum for care navigators. And this way we can utilize the local expertise of people, home care aides, personal care aides, community health workers, who know the system, who know every resource in the community, and are expert in being in the home and speaking with caregivers and people with dementia. There's a curriculum, everybody goes through it regardless of your training. And once you've had the training and then the experiential hands-on training, anybody who does the curriculum and training can qualify if they've got the experience. And then the third type of caregiver here is sort of who does the respite, who comes into the home. Those are home care agencies, generally, or home care registries that partner with guide participants such as myself, and Medicare approves them to receive payment through this model. One of the brilliant aspects of this model is it opens up a way for organizations who don't bill Medicare currently to receive revenue from Medicare without going through the entire application process, because they receive the revenue and payment from guide participants such as myself. So hopefully that answers your question,
Yes,
Jeff. So
yes,
three types of caregivers there, yeah.
Yeah, it's pretty interesting. The Navigator's the name that I forgot.
Yep.
And that makes sense because as a caregiver, there are, different levels. And as you said, I'm a caregiver for my wife, but she's still in pretty good shape. So I don't have to do quite as much as somebody who would maybe his wife or husband is further along. And now what do you do? Specifically, the respite care is tremendous because it's easy to get overwhelmed and bogged down and confused and you name it, get that way and not know what's going on. So now it gives them a chance to step away from it and say, caught my breath, now I can get back to it.
The goal here is that nobody faces dementia alone. And so just, the respite, the tremendous benefit. Additionally, just someone to call. Dementia is exceedingly diverse, but in its manifestations of symptoms, many overlap, repetitive questioning or challenges with sleep. And so having someone as you first even get into the process to call Care Navigator, hey, I'm noticing this, or feeding, whatever it may be, the Care Navigator has done this many, many, many times and can talk you through situations and can get you resources that help the family caregivers. And gosh, wouldn't it be great if everybody facing dementia had the opportunity to talk to somebody who knows them, knows their loved one, and can get them the resources and really an ear to listen,
Mm-hmm. Yeah,
so that's the care navigation role.
That's really good. Once again, we'd like to thank Dr. Adam Perry from Health Partners, Southwest Florida, and we'd like to thank him for his time and the information that he just shared with us to the guide.
We'll be right back to Gut Punched, Alzheimer's and Caregivers.
My grandmother had Alzheimer's, and I remember we were all in the hospital room, and for like 10 seconds she recognized who we were, and then it was gone. So it's like a thief. It's taking away memories and who you are as a person. Over 5.5 million Americans have Alzheimer's. That number may double by 2050. For more information, visit rightfocus.org.
This is Gut Punched, Alzheimer's and Caregivers.
And don't forget, register today for Walk to End Alzheimer's. Together, we can end Alzheimer's disease. Find your 2024 walk. Go to alz.org. That's the Alzheimer's webpage. And on that, you'll see information. And it's held annually in more than 600 communities nationwide. Walk to End Alzheimer's is the world's largest event to raise awareness and funds for Alzheimer's care, support, and research. Register for your local walk. You can start or join a team and invite others to walk with you. Or you can start fundraising and sharing. The Alzheimer's Association makes it easy with tools like Facebook fundraisers and their ALZ fundraising app, and there's a lot more. Also, join us on Walk Day. Come together for an inspiring community event that celebrates our commitment to ending the disease. Walks that are coming up: Miami, Florida, November 16th. Fort Myers, Florida, also the 16th of November. And the same goes for Tallahassee, Florida, all on November 16th. In St. Petersburg, Florida, you have one coming up on the 23rd of November. Broward County on that same day, November 23rd. And the Treasure Coast, which is on the east coast of Florida, December 7th. Well, our time is up for today. Hope you enjoyed our conversation with Dr. Adam Perry. There was so much more information from the interview about the guide that we will continue with the interview in part 2 in our next podcast. If you know someone who has a family member or friends who are dealing with a loved one who has Alzheimer's or any types of dementia, please share this podcast with them as we try and grow it to reach more caregivers. We would appreciate that very much. For more information, you can check out Alzheimer's Support Network at alzsupport.org, the Dubin Center at dubincenter.com. And to find your local chapter of the Alzheimer's Association, you can visit alz.org/local resources. Find your local chapter. Now, Dr. Perry's HealthSpan Partners website is https://healthspanswfl.com. And the link to the guide is https://cms.gov/priorities/innovation-models/guide. A lot of backslashes, a lot of dots and govs and whatever. But anyway, our website is gutpunch.com and the email address is gutpunchedac@outlook.com. Thanks for joining us, and please come back again for more. God bless.
This has been Gut Punched, Alzheimer's and Caregivers, with your host, Jeff Edwards. Don't forget to hit that like button and subscribe to us on all the platforms like Spotify, Apple, Pandora, and more. If you have a question or want to get in touch, our email is gutpunchedac@outlook.com.